carving some time out with us today. I'm calling to you from my office in my home in St. Louis, Missouri, and so I'm sure many of us are working across the country, either in an office or remote. So we appreciate you again spending time with us. So today we're going to talk a bit about how we support monitoring of different populations that you care about inside of your organization. And primarily, the focus today will be on the ordering, referring, prescribing, and attending population. So since we've got a pretty large group of participants, I think it might make sense to spend a moment and talk a little bit about what ProviderTrust enables for those that are on the phone. We have a good mix of organizations that currently have a relationship with us and organizations that are coming to ProviderTrust for the first time. So maybe worth taking a half a step back and talking a bit about the way that we help enable eligibility verifications across all the populations that matter to you at every critical interaction that requires a verification. And so the continuum of populations that we support inside of our platform covers really the main four types of populations. The first is the provider network. And that is where we're going to spend a lot of our time today. We'll talk about a really common use case. We'll kind of define that population a little bit, and we'll show you some of the capabilities and the functions that we've created to help monitor those populations based on the specific needs of that group of people. But it's also worth mentioning that we've got a platform that also supports, again, all of the populations. So many of the participants on the phone choose to leverage ProviderTrust to support their employee populations and all of the interactions that occur with that type of individual. For example, that might be making a decision to onboard a new hire and to validate eligibility, and also to ensure that every day that they come to work, that they are eligible to do the job and provide the care that they are being asked to provide as part of the job. So it's very similar with medical staff. Those are folks that have different needs, different certifications, requirements that need to be verified for eligibility. Every time that either they're up for credentialing or re-credentialing, or frankly, every time that they're seeing a patient, there's a verification that is needing to be performed to make sure that they have everything that they need to be compliant, to preserve and protect the patient, as well as preserve and protect the revenue associated with the care delivery. And then the last population that we'll talk a bit about is the vendor population, which is a population of folks in which you are acquiring services, materials management, supply chain functions, or essentially onboarding vendors and acquiring services and products throughout the length of the relationship with that vendor. And there are many interactions inside of that require a verification of eligibility to be able to do business with those types of vendors and the vendor owners. And so just to kind of paint the picture of the full continuum or life cycle of populations that we support. But again, let's spend the next 10 minutes or so talking about the provider networks. And really to help have this conversation, I'll be bringing in Eric Carroll, who works on our product team, to showcase one of the applications that we plan to work through today in the workshop, which is Dash. But before we do that, let's really frame out the problem or the challenge associated with verifying the provider network population. These are individuals that are ordering, that are prescribing, that are referring, that are attending any sort of care scenario or episode for a patient or a potential patient. So what do we know about this population that makes it difficult, right, or has a nuance around managing that population? Well, the first is that they're likely highly variable, right? You often have a large network, and those individuals aren't referring patients in at the same frequency as others. So there's often an evaluation done on how long somebody needs to be monitored inside of the network based on the last care episode. These people are not employed for the most part. So you don't have kind of the rich data that you would have for an employee. You likely only have access to an NPI number. So how do you do a sophisticated monitoring experience, or at least create that inside of a process that helps support the people that make decisions around these types of people. And so let's talk about some use cases, right? Before we actually jump into the software to kind of paint out the picture that we'll talk through in the software. So one of the most common times that a provider needs to be, that is part of your network, needs to have an eligibility verification performed is when you see them referring a patient. And so some of the big questions that you have to ask yourself at that point in time is, well, is this provider, have they been credentialed? Have they been privileged? And are they part of my existing network? Have I seen them before? Have they referred us patients before? And are they eligible to refer patients to us today? By way of, are they an excluded provider? Do they have the necessary licenses in order for us to support the patient? Are we opening ourselves up for risk or any billing issues if we were to accept that patient? So two questions that come into mind, right? Number one is, are they currently part of our referral network? And if not, what type of verification and what interaction does that verification need to be performed at? And we'll talk a bit about that. Obviously, organizations have a lot of referring providers. It's a pretty wide organization type. Population type. And so let's really start with the use case of, so I've got, I'm a scheduler that has just received a referral from a who is not part of our network. So the question is, should I schedule this patient or not? So Eric, if you don't mind kind of helping this conversation and narrative along, can you talk a bit about the ways that ProviderTrust and specifically Dash can help support that initial verification requirement at the interaction of, should I accept this patient for this provider that I really don't know much about?
Yeah, absolutely. So with Dash, what we've created is an ability to instantly check with just an NPI number against our enhanced data set of exclusions and NPPES list. So immediately with an API capability, we have the opportunity for that scheduling person and whatever software they're using to set up that provider with just the NPI that you get on that referral form or order form. And check immediately against our enhanced data set, is that person excluded on any federal or state lists and has a valid and active NPI to be able to perform that ability. And so with that API, really we're bringing that data and that ability when you first have an interaction with a provider to make that call right at the get-go. Within milliseconds to have an answer rather than an antiquated name lookup against the various date resources and other things. And our hope there is that it saves a lot of immediate time, gets you the care and attention that you need on this population right away. And in particular with an audience at your schedulers or whoever is taking these initial intakes that might not know the intricacies of compliance needs, the information just that they need to be able to do their job in a confidence that what you're bringing into your business and into what you're caring for are compliant and those providers are in good standing.
Great. So I heard one really important thing inside of that, which is there are many different types of systems used to support the operations of a health system, and one being and a very big one being an EHR or an EMR. And so how are we helping make a decision in an application like an EHR or an EMR and kind of facilitating or enabling that decision to be made in the system that they're making decisions in?
Yeah, so that goes back, Tim, right to that integration. So based on the workflows that you all set up with your systems and whatever that system is, we're agnostic to the different systems that exist out there. But it can create a workflow that creates and hits our data set and provides that immediate reaction of just saying, hey, everything with Dr. Robert Redford is good and in good standing, except this patient. And you can feel confident that is not a doctor that will cause issues or create issues with your operation.
That's great. Perfect. Okay, so let's move this use case along. So now we've got a patient that we've accepted. We're providing care. How do we enable a kind of a continuous monitoring process for Dr. Redford in this example, given the fact that Dr. Redford might have other referring patients that he sends or she sends to us, as well as might be involved in some sort of care while they're within the four walls of the system that I work in, the health system, and through the continuum of care for that particular person.
Yeah, so while seeing a provider for the first time and accept them into the care is great for that instant search, we know that potentiality of your interactions with that provider might continue on for any length of time, whether they're sending you many clients, one client, or the care of that patient is elongated, and over time you might need to know the status of this referral at any moment. And so you might be familiar with a lot of the ongoing monitoring that we have within our other products, and this applies to this population as well. So what I'm showing you right here is Dash. This is the dashboard that you would look at to see, hey, out of all the referring providers or ordering providers, attending providers that I'm keeping an eye on right now because they are interacting with my patients in some way, what is the current standing? What's going on? And you can see here that we have over 10,000 providers, all within NPI, within this ongoing monitoring. This really gives you a quick overview of that population, to that active population, however you define it. You can see I have it set up. We have an ability here to organize by business units. This is a way just to organize whatever your business looks like. That could be regions, that could be specialties, areas of operation, whatever that looks like. But this helps you drill in and understand what does that nuanced population look like.
Great. Okay, so I suspect that this dashboard is what I would look at and use if I'm overseeing compliance of my network operations. Let's, in the last couple of minutes that we have, work through an example of an alert. So let's say I've got a referring provider. We're doing continuous or ongoing monitoring to ensure that they are compliant and eligible to be referring patients to us. Work through one of these alerts in which we, I assume inside of this dashboard, are saying, hey, I found a provider that has a change in status. We need to alert in the system, one, that this referring provider is no longer eligible to refer patients. But help us walk through how the application enables an investigation and kind of all the way through to defending the decision that we have made about removing the referring provider from our network.
Sure. And the first thing to know is that anytime that you have a dashboard where you have alerts that need review, you'll have an email sent to you letting you know about the status of your dashboard, of whether or not there's any new alerts. As you can see here, here's an example of one that was received for this account that I'm showing you right now. So anytime that an alert pops up, you'll get a summary the next day of the number of alerts that you have to review. In this account, we've set it up that right now there's about 11 exclusion alerts that you need to review and 4 issues with the NPI that we've identified. So I'll go ahead and go into an exclusion alert. So you can see here, I can just click on the 11, and this shows me all 11 excluded individuals that I might need to look up and do. And we'll click on John Cruz here. So John Cruz, we have found him as excluded on both the Pennsylvania and OIG list today. And if I go down, I'm looking at the OIG exclusion. And you can see here, we've matched it based off of the NPI. Again, that's our enhanced data set that's giving you this accurate information. And you can go in, and over here is the information that you have, John Cruz, first name, last name, and the NPI. And then you can see on the left side, the information found at the source. So you can see that it also has the same NPI there, as well as other information that he's specialty of surgery, Philadelphia, Pennsylvania, and the date that he was originally excluded. What we've also included is the ability to provide status updates. We know when you first see this and hear this, that might start off a chain reaction of things that you maybe need to go look up. Hey, do we have any outstanding, patients today that are connected to this provider that sent this referral in? Have we been providing care, or do we have some care coming up for this patient? Or do we have any claims that currently are going out to Medicaid or Medicare that have this excluded referring provider on there that I might need to go and talk to my revenue cycle team? So we give the ability here to place a status to be able to put it into a needs review, under review, and resolved. And this gives you the opportunity, just you, to be able to manage then all the various conversations that you might have coming up. You might need to go get more information from this doctor if necessary, as well as then have that follow-up. So this gives you a tracking ability to update that status, as well as provide notes for you to go back to track it, who you've communicated to. And then ultimately, if determining on how you manage your referral networks, you might terminate this provider, or say, hey, we've reviewed this, we've done the necessary pieces and bits that we need to make sure our business is protected, our patients are protected, and we've worked through this as we can, and you have this ability to be place them in a resolved status, and add a note. So I'm going to add a note here: ended relationship with this provider, and have that documented in your system now ongoing. So that way, if they do come in again, or you need to do a review, you have this information here showing what we reported you, the day that we reported it, the steps that you took, along with the dates of which you took them there.
Great. Okay, so just to recap that very quickly, I saw a number of things. First was the data that we received on the provider was minimal, but the data that we found via our enhanced data was pretty significant, which tells me that we're able to find excluded providers much faster and actually find more than what would be available with just publicly available data via that enhancement. And then I also see not only are there dashboards that help drive prioritization, but alerts that are driven inside the dashboard that help us prioritize, give us task management tools inside of it to kind of work through any of the results that require attention, all the way through to resolution. And I suspect that there's a whole host of reports as well that support being audit ready and defending the decisions that we've made across this population, not only with the initial verifications, but also the continuous monitoring that we're doing for this network. Is that correct?
Yeah, absolutely, Tim. So we know one of the important aspects for what our services provide is the ability to show what did we know, or what have we reported to you around monitoring these providers. So that way you can show proof in an audit situation that your program is exceeding standards and what's happening there. So we've made it really easy to pull together reports. So the specific report I'm going to show you today is the individual audit report. This is what we use to show proof of monitoring to auditors. I'm going to select yesterday, as well as that same John Cruz that we were looking at just a minute ago, and pull this down and download the report. So if you might need to show over a couple, like just a specific date and time, what do we know? This is a great report to pull it up. And so here we have a PDF with ProviderTrust. When did you generate this report? The date that this report and this search was looking at to show what the status was, as well as then the information on this provider, NPI, and the overall monitoring status. And what we have here is showing you those alerts that they have an active NPI, but we have found them and they have been matched on the OIG and Pennsylvania exclusion list, and that they were excluded at that date of October 14th, 2020.
That's fantastic. So it seems to be pretty comprehensive. Tells us that we've searched all federal, all state exclusion sources, and have actually found an exclusion record for John Cruz in two separate areas, and report that back. So that's great, Eric. Thank you. I know we've gone over about 5 minutes. I hope this has been valuable to you and your organization. Matt, if it's okay, we'll go ahead and wrap up the conversation from here.
Yeah, thanks Eric and Tim for being with us today, and thank you everyone on the call. If you have any questions about today's session, you can respond to any of those invites I sent you over the past couple of weeks. I want to say thanks again for choosing to spend your time with ProviderTrust. Please fill out the survey so we can continue to bring value to you guys, and we will see you next month. Thanks everybody.
Thanks, Matt. Thanks, everyone.
Thank you all.